Hello everybody, welcome back to chapter 16. This is our final part of the chapter where we are going to be taking a look at the adrenal gland. Remember, the adrenal gland sits right on top of the kidneys, and what we're going to be doing in part 4 is we're going to take a look at how it's two different sections: the cortex, which is its outer layer, and the medulla, which is its internal layer, the hormones that both of those produce. And we're also going to take a look at how, from an embryonic standpoint, those two sections are vastly different. All right, so go ahead and take a look at the illustration that is on the right-hand side of your PowerPoint, and you've seen this before. It is just all about the locational site of the adrenal gland. You can see it sits right on top of the kidneys. There you go. And if we were to zoom in on the inside, what we would see is, as you've mentioned before, is that it has an outer layer called the cortex, and it has a medulla layer, which is going to be its internal layer. Now, even though both layers make up the adrenal gland, what we see happening from an embryonic standpoint is that they are made out of vastly different tissue. In fact, the cortex tissue is made out of glandular tissue, and the medulla is made out of nervous tissue. So we're thinking our neurons and our glial cells, and that is one of the ways, that's one of the reasons why the nervous system is able to directly communicate with the medulla and cause its secretion and its release of its hormones, because of the same embryonic origin as those neurons and the glial cells are. So as you can see right here on the PowerPoint, it says it's made out of nervous system that is part of the sympathetic nervous system. And the nervous system part obviously indicates the neurons and the glial cells. The sympathetic part means that when it responds, it will have an heightening increase on the body, meaning that it's going to cause an increase in your heart rate, in your breathing rate. It's basically going to get you super excited. Some of you might remember from 2085 that the opposite of the sympathetic nervous system is the parasympathetic nervous system, and the parasympathetic nervous system has a calming effect. All right, so let's start exploring the cortex. So as I mentioned before, it is made out of glandular tissue, and what we see happening when we take a look at the histology aspect of this outer section of the adrenal gland, the cortex, is that we have three particular layers that point out, and these layers are called zonas, and we see basically from top to bottom, the layers are going to be the zona glomerulosa, the zona vasculata, and the zona reticularis. And these particular zones are going to be important because each of them will produce their own set of hormones. So the zona glomerulosa, which is the top layer, will produce what we call mineralocorticoids. The zona vasculata will do glucocorticoids, and the zona reticularis will mostly produce gonadocorticoids. Now, this is important to point out because what we're going to do is in the next few slides, we're going to take a look at which are the main hormones that fall in each of the categories. But before we do that, let's take a look at some illustrations so we can better orient ourselves around the adrenal cortex. Okay, so here we see from a histology standpoint, we have the cortex section, and notice how it's bracketed off to indicate the three particular layers. Starting on top, you have the zona glomerulosa. Then in the middle, the largest part is going to be the zona vasculata. And then last but not least, the bottom layer that will come into contact with the medulla, that one is going to be called the zona reticularis. Okay, and as you can see right here in this section that I'm going to shade in, that's going to be the middle part, the medulla section. That one is made out of nervous tissue. So we're going to talk about that one in a little bit. What you can also do is you can go ahead and look all the way over to the right-hand side, and you can see examples of the main hormones that fall into the category. So for the zona glomerulosa, when we were talking about in our previous slide that it produces mineralocorticoids, the main one is going to be your aldosterone. And then in the zona vasculata and the zona reticularis, we're going to see cortisol and androgens, excuse me, that come into play. Androgens are going to be your sex hormones, so your testosterone and your estrogen that come into play. And as you can see right here, and I know I'm getting a little ahead of myself, in the medulla itself, we're going to have some neurohormones, so a different category. These are going to be your epinephrine and norepinephrine. All right, so first things first that I want to remind you of is, remember when we talk about the adrenal cortex, we had mentioned before that the adrenal cortex is going to respond to one of the hormones that the anterior pituitary gland secretes. This particular hormone is a tropic hormone, meaning that it will cause the release of the hormones within the adrenal cortex. Now, do you remember the name of the hormone that the anterior pituitary gland secretes that will directly affect the adrenal cortex hormonal secretion? Hopefully you went with the adrenal corticotropic hormone, your ACTH, and that would be the hormone that the anterior pituitary gland secretes, and that then travels over to the adrenal cortex and will then cause a cascading effect of different hormones to secrete. If the ACTH goes over to the zona glomerulosa, it will go ahead and cause a mineral corticoid to be secreted, and that mineral corticoid, even though there are different hormones within that category, the main one I want you to pay attention to is aldosterone, okay? So aldosterone is going to help us with our regulation of our minerals, meaning our electrolytes, and our main focus is going to be on sodium and potassium because of the fact that sodium has a depolarizing effect, for instance, on your muscle cells, meaning it gets them all nice and excited, so it's needed for the contraction, whereas the potassium has more of a repolarizing or relaxing effect, meaning it's needed for relaxation. In addition, sodium will also have an effect on our extracellular fluid because it's the main electrolyte floating around in our body, the main solute, and because it's able to do so in the movement of the water, it will also play a role in things like blood volume, which means that it will play a role in blood pressure, as well as the movement of other ions that it carries with it, such as your potassium, your hydrogen, your chloride comes into place as well. And of course, the potassium, want to keep in mind that that's going to help in our repolarization set, meaning that that is what the muscles will, your muscular cells will utilize, for instance, to calm back down over to their resting membrane potential. Now, for those of us who are keeping our table and we want to know exactly what am I going to write down for aldosterone, I just want you to take a look at the highlighted sentence that's towards the bottom of the slide. And you see right there that what we're going to do is, for its main function, we're going to write down that it stimulates sodium retention and potassium excretion. And this statement is extremely important because that will then go ahead and piggyback to the bottom statement, which is basically that by regulating how many sodium and potassium ions are, we can then directly go ahead and correspond and control our blood volume as well as maintain our blood pressure. So aldosterone is going to be our main hormone that we find in our zona glomerulosa, and it's going to be all about regulating our ion concentration so that we can indirectly control our blood volume and blood pressure. Now, the zona vasculata will go ahead and mainly focus on glucocorticoids. Glucocorticoids fall into the category where we take a look at our cortisol, cortisone, and corticosteroid. And for us, the one that we really care about is going to be our cortisol. Okay, so the cortisol is the main hormone that we're interested in for our glucocorticoids in our zona vasculata. Now, what exactly is cortisol going to be doing? Well, first of all, cortisol tends to be excreted in times of stress or during our flight or flee mechanism. So anytime we get like really angry or stressful or we start panicking, our body goes into this fight or flee mechanism. And one thing that we see happening is that cortisol starts to get released. Cortisol is going to help you in many different ways during this situation. One of them is that it wants to make sure that your body has enough nutrients and energy. So it's going to help with the metabolism of glucose and other fuels to make sure that the brain has enough access to glucose, to make sure that the cells are able to take the glucose and go ahead and synthesize their ATP molecules so that you're properly fueled during this stressful situation. It will also help with things like glycolysis, gluconeogenesis. Remember we talked about that? Anything that it can do to make sure that you have energy floating into the blood. The problem with cortisol is that it has an anti-inflammatory effect, which tends to be very helpful in a stressful situation because it will kind of, calm, it will reduce the immune system down so you don't feel any pain, so that you can literally run or fight your way out of the situation. However, on a prolonged analysis, this anti-inflammatory effect can cause us to become severely immunosuppressed. And when you become immunosuppressed, that means that you are more vulnerable to different bacterial as well as viral infections, as well as the development of things like ulcers. We also see that during high levels of cortisol that your reproductive system will actually start shutting down. So heightened levels of cortisol for prolonged effects can have very negative effects on the body. Anything from immunosuppression to actually shut down of the reproductive system. The gonadotropins are mostly found in the zona reticularis. And I just want to point out something is that in the zona vascularis and the zona reticularis, actually both of them will be able to do the gonadotropins and the cortisol production. However, what I've done on the PowerPoints is I've basically divided it based on a ratio basis, which one produces most of them. So please don't be surprised as if you look up on another source for your gonadotropins that it also mentions the zona vascularis when it does it. Same thing with the cortisol that it mentions the zona reticularis. So this is just based on a ratio which one produces the most that I've subdivided it for you. The gonadocorticoids are going to be your sex hormones. So these are going to be applicable to both the males and the females. And what we see is that this particular layer of the adrenal cortex will provide an additional source of both androgens, meaning both testosterone and estrogen. So the testosterone is mostly used by females as a source of providing hormone that's needed for the libido, as well as for other developments of the secondary sex morphology. So on your slide, I wrote down that androgens set the libido throughout the lifetime. They play a large role in the prenatal male development, meaning before the testes are fully active, including DHEA, which is a precursor to the testosterone, as well as other tissues that will obviously convert to testosterone. In females, the zona reticularis will be our source of our testosterone production. In addition, the zona reticularis also produces estradiol, which can go ahead and be converted into different versions of estrogen. This is going to be important because the males also require small doses of estrogen for a fully developed reproductive system, as well as for the sex libido. And what we see happening is that the males will then be able to derive their estrogen from the zona reticularis. Now, females, mostly, they kind of just ignore the zona reticularis until we get to our menopause phase. After menopause, what we see happening is that the ovaries will start shutting down, meaning that they do not secrete high levels of estrogen anymore. However, our body still requires it. So where are we going to get this estrogen? Well, from the zona reticularis. So it is extremely important to point out that the production of both testosterone and estrogen, even though we like to associate that with the testes and the ovaries, we also need to think about it in the adrenal cortex contact, mostly from the zona reticularis. So if you come across a question where it says, what source do males use for estrogen production and secretion, please make sure to pick out the adrenal cortex, or if it's asking for more specific, the zona reticularis. And the same thing goes for females. Where do females get their testosterone from, or where do they get their estrogen from after menopause? Please make sure to pick the adrenal cortex, primarily the zona reticularis. All right, let's take a look now at the middle section of the adrenal gland, which is the medulla. Now, the medulla will be very similar to the cortex. It will respond to the body in times of stress and during the fight or flight scenario. The difference is that with the medulla, because it is from a neurological embryonic standpoint, it will produce a whole different category of what we call neurohormones. So the hormones will be different than the ones that we saw in the cortex. Now, we call them neurohormones because inside the medulla we have what we call chromaffin cells. Chromaffin cells are modified neuron cells, and because these are the cells that will be producing and secreting the hormones, that's where the name the neurohormone comes from. The hormones being secreted in the medulla fall in the category of catecholamines, and the ones that we're really interested in are going to be epinephrine and norepinephrine. Now, hopefully when you hear epinephrine, you go, hey, that's the one that gets you all hyped up, that gets you all excited, which makes perfect sense because, remember, the medulla is able to activate the sympathetic nervous system. So it is going to get you all hyped up. It's going to do things like increase your heart rate. It's going to increase your respiratory rate. You're going to notice that you have an heightened sense of activity. You're going to go ahead and notice also that your blood glucose level starts to increase because your body's looking for your body's making sure that you have enough fuel to go ahead to all your different organs, primarily to the brain, the heart, and the skeletal muscle system, to make sure that you have enough energy so that you can think about the decisions that you're making. And for the skeletal system, that's really important because of literally the fact that you might have to run away or you might have to fight in the situation that you're in that's causing these stressors to activate the adrenal medulla. It will also have effect on your blood vessels, and part of that, as you can see on the slide, it says it will do vasoconstriction, and by constricting the lumen, making it a little bit smaller, it makes it easier to redirect the blood flow away from non-essential organ systems, like for instance, the digestive system, over to more important items like the brain, the heart, and the skeletal muscle. Now, please keep in mind that with the adrenal medulla, since that one is able to communicate directly with the nervous system, whereas the cortex is going to be relying on the release of the ACTH hormone from the anterior pituitary gland, the activation is quite different. Also, the hormones being produced in each section is quite different, but both sections of the adrenal gland are responding anytime your body is in a stressful situation. So hopefully you're going, well, okay, so they're responding different. Is there any other differences, right? And it turns out there quite is. The medulla tends to respond more in an acute or short-term stressful situation. So its response to it won't be on a long-term basis. You'll just have a quick response and then everything will kind of calm back down. Part of that is because the parasympathetic nervous system will kick in and override the sympathetic nervous system. Whereas the adrenal cortex, as it's releasing the cortisol, its response is more of a long-term response to stressful situations. So both of them will respond to stress. Obviously, their hormonal secretion will be completely different, but the medulla tends to be more in short-term stressful situation, where the cortex tends to be more in long-term situations. Let's go ahead and switch over to our next slide and take a more detailed look at epinephrine and norepinephrine. We also see with the epinephrine and the norepinephrine that they're able to go ahead and have control of our metabolic activity, and part of that is because they're going to be able to redirect the blood flow as well as the glucose secretion. So as you can see right there with epinephrine, you have your bronchial dilation and you have your blood flow away from other organs like the digestive system and over to the skeletal system and the heart. Norepinephrine is very similar in its effect, will also have an effect on the peripheral vasoconstriction as well as the blood pressure. Now, these responses tend to be very brief, unlike the adrenal corticohormones. All right, so let's take a look at this little graph. I don't know about you, but I love a good visual of what's happening and what we just talked about. So this is figure 16.6, and it takes a look at how stress and the adrenal gland go hand in hand, and it basically shows you that both parts of the adrenal gland are very active into the stress response. However, their method will be completely different. So let's start on the left-hand side, and we see that in the short-term stress response, we rely completely on the adrenal medulla. The adrenal medulla will get its activation from the nervous system. As you can see right here, we have our sympathetic fibers that are coming down from our spinal cord, entering the medulla section, and as a response, we're going to go ahead and we're going to release our catecholamines, our norepinephrine, and our epinephrine. And even here at the body, you can see towards the bottom, you can see that the short-term response will be all about making sure that the body has enough glucose and making sure that we do things like increasing our heart rate, increasing our respiratory rate by dilating our bronchioles, and of course making sure that blood flow is adequately changed so that it goes over to the most important sections of the body that need to be utilized, such as the brain, the kidneys, and the skeletal system. If you now make your way over to the other side of the graph, you can see that stress will also affect the cortex section of the adrenal gland. In this case, it will be more of a prolonged stressful situation, and in this case, we're going to rely mostly on our mineral corticoids as well as our glucocorticoids. And if we're looking down, we're going to notice that it involves different parts of the body to make sure that our blood volume and blood pressure the blood volume and the blood pressure will slightly rise. Part of that will help us with our glucose distribution. We're going to look for plenty of food sources or energy sources. So in addition to breaking down glycogen, we're also going to look for proteins and fats that can be converted into glucose through glycolysis and gluconeogenesis. And then please keep in mind that one of the negative effects of involving the cortex in stressful situation is the fact that if you have high levels of cortisol for a prolonged period of time, it will have a suppressive effect on your immune system. And that, of course, could make you more prone to other bacterial and viral infections, so you tend to get sicker quicker. I also want to point out something very important on this graph, which is that if you look right next to your adrenal cortex, notice the mention of ACTH, your adrenocorticotropic hormone, which comes courtesy from your anterior pituitary gland, and that, of course, is the tropic hormone that is released through the anterior pituitary gland that travels over to the adrenal cortex, which is then needed for its secretion of its hormones, such as the mineralocorticoids, which of course is the aldosterone, and the glucocorticoids, which was the cortisol that we were discussing, in addition to also the androgens, the testosterone, and the estrogen, which of course do not apply to the stressful situation, but obviously also play a very important role in both the male and female homeostatic basis for the reproductive system. Now, having said that, this is the end of chapter 16. So congrats, we made it through our first chapter. I once again want to encourage you to stop on by the office hours or send me an email if you have any questions, comments, or concerns. And obviously, please utilize the discussion sessions. And beyond that, please make sure that you get yourself all signed up for mastering through the Canvas link so that you can start getting ready for taking your first homework, which isn't due for a while, but you can start making your way through mastering. And if you're not familiar, there is a little assignment set up there that will welcome you there and will walk you through. So all the details of getting access to mastering can be found in the syllabus module. And of course, we're going to enter mastering through the Canvas link that you can find on the left side menu of our course shell. All right, everybody, that will be the end of chapter 16. And what we're going to do is next is we're going to transition to chapter 17, which is going to start exploring the cardiovascular system by focusing on blood first off. All right, so I'll see you for chapter 17.